Um, we want to do whatever is most comfortable. So hopefully I've piqued your interest with these exercises and talking about somatic experiencing. If I have piqued your interest and you're interested in finding a somatic experiencing practitioner, you can do so by going to traumahealing.org. That is the website for the Somatic Experiencing International, and there is a practitioner directory on there. I think it's important to, well, if you're interested in somatic experiencing, to find a somatic experiencing practitioner. The SEP credential behind that person's name is one way to know that you're working with somebody who has taken the entire SE training. The SE training is 36 days of professional training across a 3-year period. And it is an intense training. This is not a standard talk therapy way of working. So someone, just coming out of graduate school who hasn't had the SE training wouldn't be qualified to be doing this approach. There are a lot of somatic therapies out there that are very good, but somatic experiencing is the one I'm most familiar with. So I hope like I said, that I've piqued your interest. This is a wonderful and gentle way of working, not only for trauma, but also for any dysregulation in the nervous system. If you have anxiety, if you have depression, if your system is bipolar, any of those things, this can be a very useful way of working. Also very useful for people whose nervous systems are, in SE terms, we would call it a syndromal nervous system. So these are systems that show up as having often chronic medical conditions, things like chronic migraines, fibromyalgia, autoimmune disorders, unexplained pain syndromes. Often there is a trauma aspect to that, and stress definitely exacerbates these syndromes. So SE is a very, very good way of working with the nervous system to help it settle, and often clients have tremendous improvement in symptoms when working with a somatic experiencing professional. So again, hopefully I've piqued your interest. Thank you for joining me.